But one article that I did find through the help of a friend was in Orthopedic Practice, 2017, a study by 4 physical therapists titled Association Among Select Clinical Data and Successful Completion of a Treatment Plan in an Outpatient Orthopedic Physical Therapy Setting. 4 therapists from Rhode Island, Mark Baston, Ryan Tower, Michael Nula, Jason Harvey, looked at the data that they collected from 669 discharged patients between 5 months of a particular year to see how well they progressed and if they could correlate their progression and their gains and their successful discharge essentially to the number of times that they came per week on average for their care. And what they found was what you would expect, but unfortunately we don't see in a lot of clinics. And that is that, I'll quote them here, maintaining a frequency of 2 visits or more per week led to successful completing the treatment plan 93% of the time with a normal discharge. Compare that to the average visit frequency and the correlated successful discharge rate to those who were, say, in the 1.0 to 1.66, 67 average visits per week. The range of successful discharges is between 48% on the low end at 1 time per week and 69% on the high end. Whereas if they come a minimum of 2 times per week, on average, there's a 93% chance that they're going to be successfully discharged, right? Well, and what does that mean to you? Well, it can mean a whole cascade of positive effects if they came in the average frequency that they're supposed to come per week and the total number of visits, because they'll go on and say, and we'll talk a little bit about the results, but they do go on and say, quote, keeping in mind that the number of visits per week is an average, a therapist can decide to adjust the frequency of visits in order to be sure the average is maintained. It is within the scope of physical therapist practice for the therapist to set and adjust frequency of treatment as part of the plan of care. For example, if a patient is only able to attend therapy once during a particular week, it may be beneficial for him or her to attend 3 times the next week in order to maintain an average of twice per week. The results of this study suggest that controlling the number of average visits a patient attends per week leads to greater outcomes. So in the Physical Therapy Owners Club, we're always talking about how to increase freedom and profits for the owner, what they can do, how can they improve. But we've got to understand that what we do that is beneficial for patients is ultimately beneficial for our businesses as well. And one of those key stats is this in particular, the average number of times per week.